Welcome to my channel. Today we're going to be discussing telehealth. There are so many questions that come up around telehealth, especially for seniors. It's convenient. Is it safe? What about prescriptions? Can I get physical therapy? And these are some of the questions that we're going to answer today. But before we dive in, if you like what you see here, please make sure to subscribe and turn on notifications so you know when we post new videos. So first things first, what is telehealth? Telehealth has been around for a while, but recently it's exploded in popularity due to the COVID-19 pandemic. In fact, way back in 2015, only 35% of hospitals offered telehealth services. And fast forward to 2020, that number jumped to over 80%. The Health Resources and Services Administration, or HRSA, defines telehealth as the use of electronic communications to deliver health services remotely. This broad definition includes any type of remote care, including but not limited to video chats with a doctor. Telehealth can take many forms, such as store-based telehealth, where a patient visits a retail clinic and uses a kiosk to have a virtual visit with a provider, or a more traditional virtual visit from the comfort of home. One thing that sets telehealth apart from in-person visits is that it's not necessarily synchronous. That means that the patient and provider don't have to be interacting at the same time. There are some instances where a patient might send information to their provider asynchronously, meaning at a different time. For example, a patient might submit their weight and blood pressure reading to their provider via an app. Then the provider could look over the information and potentially schedule a follow-up visit. And this doesn't always need to be done virtually. Sometimes this can be done by phone. Now that we know what telehealth is, let's talk about how it can benefit seniors. The most obvious benefit of telehealth is the convenience factor. Many seniors struggle with mobility issues, which can make driving to a doctor's appointment difficult. Not only does telehealth eliminate the need for transportation, but it also eliminates the need for time off work to attend an appointment. Seniors can attend doctor appointments from their couch, bed, or even their backyard. This can make healthcare feel less stressful, and therefore help seniors adhere to their treatment plan. Another benefit to consider is that telehealth makes it easier to get access to specialists. If there aren't many specialists in your area, telehealth can open up a world of possibilities. Seniors can now access specialists who may live hours away. We've talked about some of the benefits of telehealth, but now let's discuss the technology required for a telehealth appointment. To start a telehealth appointment, all you need is a smartphone or computer with internet access. If you have a smartphone, you may already be familiar with FaceTime or Skype, which can be used to conduct telehealth visits. Some telehealth platforms will actually send you a link, so you do need to download an app to your device. Now, some platforms do require a camera, but if you do and have one built into your device, or you just prefer not to use one during an appointment, that's okay. You can still participate in telehealth through your audio. The Center for Connected Health at the American Medical Association recommends testing your technology ahead of time. This ensures that you're connected and that everything is working properly. You can test your connection with your provider's office or by visiting the platform's website. The websites usually have resources to help you test your technology. Once you've tested the technology and you're ready to go, you'll want to ensure that you're in a well-lit, quiet room to reduce any distractions during your appointment. Alright, let's talk about prescriptions. Can you get a prescription through telehealth? The answer is yes, but it depends on the state that you live in. Each state has different regulations around the types of prescriptions that can be given during a telehealth visit. So what you need to do is check with your state board of medicine to find out what they specifically allow. According to the American Medical Association, some states allow for full prescriptions to be written through telehealth, while other states limit the type of prescription that can be written. Certain controlled substances may be off limits for telehealth visits. Also, some states may require an in-person visit before a telehealth visit, meaning you'll need to visit your provider's office once before you can have a telehealth visit. Let's talk about the cost of telehealth. Will my insurance cover it? How much does it cost? It's like prescriptions. Insurance coverage varies state to state. Telehealth was recently made more accessible thanks to the Coronavirus Aid, Relief and Economic Security Act. This made it so that most private health insurance plans must cover telehealth visits at the same rate as in-person visits. However, this doesn't mean that your visit will be completely free. Many insurance plans require a copay for telehealth visits, just like they would for an in-person visit. Some insurance plans may also require prior authorization for telehealth services. Prior authorization means that you need to call your insurance company before your visit to get approval to use telehealth. If you don't have insurance, many telehealth providers offer self-pay options at a discounted rate. A good idea is to call your insurance company or the telehealth provider directly to ask about pricing. Let's talk about physical therapy. Can you get physical therapy through telehealth? Again, the answer is yes, but it depends. Currently, 36 states plus Washington, D.C. allow physical therapists to practice across state lines. This means that you could see a physical therapist licensed in another state through telehealth. However, your specific state laws may impact what a physical therapist can do during a telehealth visit. For example, in Arizona, a physical therapist can assess a patient through telehealth, but they can only develop a treatment plan after an in-person visit. On the other hand, California allows for physical therapists to do it all through telehealth. So again, the best thing to do is to contact your state board of physical therapy to find out what they specifically allow. Another important thing to consider is whether or not your physical therapist needs to physically touch you to perform their job. For example, would they need to touch your arm to check your reflexes? If so, then a telehealth visit may not be suitable. If not, then a telehealth visit may be an option. It's also worth noting that the physical therapists may need special equipment to perform certain tests. For example, they may need to send you equipment to measure your balance or range of motion. Here's a quick summary of what we've covered. Seniors can use telehealth to have doctor's appointments from the comfort of home. All you need is an internet-connected device such as a smartphone or computer. Check with your insurance provider to determine your coverage for telehealth visits. Coverage varies depending on your plan. Some plans require a small copay. Others may require prior authorization. If you don't have insurance, check to see if the provider offers a self-pay option. It's also worth checking to see if your state requires an in-person visit before having a telehealth visit. Not all prescriptions can be called in through telehealth. Check with your state board of medicine to see what prescriptions are allowed. Finally, you can see a specialist through telehealth, including psychiatrists and psychologists. Make sure they are licensed in your state. I hope that we've answered some of your questions about telehealth. If you still have questions, we encourage you to speak with your provider's office. They should be able to walk you through the process step by step. We also encourage you to explore telehealth as a way to receive care. You may find that you really enjoy the convenience of attending appointments from home. At Live Home, our mission is to help older adults live happier, healthier lives at home. We provide in-home care, home health care, and we even offer telehealth services. Our goal is to help seniors avoid unnecessary emergency room visits and hospital readmissions. We also want to make healthcare more convenient and accessible for those who need it most. If you're interested in learning more about our services, please visit our website. If you enjoyed this video, please make sure to like and share it with others. Until next time, everyone, stay happy and healthy.